In. So just a update on kind of going down the line. We did 560 first because we had some experts here who were limited in their time, and we need to be able to make sure for them. But we tend to go, for the most part, down scheduled list as we have it. That will be starting with LD5, but with LD5 is basically a provision that is also included in LD 1258. So we're going to skip LD 5 for now, and we'll deal with that when we deal with 1258. So we're going to jump to LD 23. This is an act to remove from the Maine Medical Use of Marijuana Act the requirement that a patient's medical condition be debilitating.
So we'll start again, and the way that I have this set up for those who weren't here at the beginning is that there's this legal document, this legal size document has the bill title and the summary, and then the statutory provisions that are impacted by the bill. So this kind of serves as a roadmap to navigate through this other larger packet, which is the entire Maine Medical Use of Marijuana Act. And I engrossed this packet to reflect the changes in each bill. So instead of having 10 different bill analysis with everybody flipping around, and then the testimony and some of the proposed suggestions and amendments are in this salmon colored packet, and then the relevant, any relevant attachments are here in purple, and I'll direct your attention to them as they come. So just for the folks who weren't here at the beginning, that's the game plan. And so I'm looking now at page 1 of the legal size document, and again, this is LD 23, an act to remove the Maine Medical Use of Marijuana Act from the Maine Medical Use of Marijuana Act, the requirement that a patient's medical condition be debilitating, excuse me. And this bill removes from the Maine Medical Use of Marijuana Act any limitation on the type of medical conditions for which patients may be certified by their physicians to engage in the medical use of marijuana. And if you see in the statutory provisions that are impacted, 2422 subsection 2 is repealed, and that's here on the first page of the packet. You can see that it's stricken there, and then all of these other provisions here are some of the ripple effects stemming from that. And so, if anyone has any questions, I'm happy to walk through the packet and show where those changes occur. So let me just. And then it also removes the provision under 2424 rules where there's the provision for adding debilitating medical conditions as well, and essentially just removes the requirement from all the different provisions in the Act that the medical condition needs to be debilitating in order to qualify.
Yes, Senator McCormick.
Thank you, Mr. Chair. Just a clarification. So we're not just removing debilitating, we're removing any limitation on being prescribed medical marijuana. The summary says.
Right. It doesn't. It makes it so that a doctor would still need to certify that it was warranted, but it removes the barrier that of what could potentially qualify as something that could be.
Thank you.
I just would like to, something that was very valuable to me when we were hearing this in the public hearing was the department's testimony. I just want to share some highlights from it real quick, just as a refresher for folks. The department supports this bill as long as the medical provider is required to maintain records supporting the certification determination and complies with other provisions of the laws and rules governing the Maine use of medical marijuana program. The department welcomes this opportunity to remove itself from the medical provider-patient relationship the state's legitimate interest is to ensure that only qualifying patients are certified to legally participate in the Maine medical use of marijuana program. We do not want to erode or make meaningless a cornerstone of the Maine medical use of marijuana program, the treatment of medical conditions that require the certification of a medical provider. So, anyway, I just wanted to restate that. Representative Kateen?
Thank you, and when I was thinking about this bill just a few minutes ago, I had the same question that Senator McCormick had, and again, you know, because Michael just went through, if you go through, the term debilitating medical condition is used several times, but I think if you really focus on some of the key terms, medical use, qualifying patient, and written certification, it seems that, you know, there is still a limitation that it be a medical use of marijuana, that it be for a qualifying patient as a person who is determined by a physician to have legitimate medical use. And then the written certification still has to, it still has to state that you know, that it's a medical use, and in the provider's opinion, it's necessary to treat or alleviate the patient's medical condition or symptoms associated with the medical condition. So again, it doesn't open up the door to anything beyond medical use certified by a provider. At least that's the way I.
That's the way I read it as well.
Representative Burstein, and then we'll go down.
Thank you, Senator. Could I just ask, so all these amends, it's in this with purple? It's all purple?
Yes.
Correct?
Yes.
Okay, so if we just go through and see where it's all crossed out,
Yes.
then we'll correlate to that.
Yep.
Thanks.
Yes, Representative Hymanson.
Thank you. So I'm just, you know, as a physician, I'm trying to walk myself through these steps. So I'd like to have some help with someone out there who might be able to help with that. So what I know as a prescribing physician is that if someone comes to me as they have, and they say, I have this symptom, I think that marijuana, medical marijuana might help me. And I say, gee, there's no evidence out there, there's no medical evidence that that might be true. I can't point you to any trials, but there are many active components of marijuana that are medically that have some efficacy, perhaps in some disorders. There are no trials, but they're pending, and we're expecting the trial results to be out. This is moving along. But if you feel compelled and you want to give it a try, I will write you a piece of paper that says you have this disorder. And so I'll put, this patient has Parkinson's disease. And I give it to the person, and the person takes it to, in my case down in Bedford, and gives it there. And there's somebody, a prescriber, who, because I have a DEA license, I can't prescribe it. So the person will take it to the Bedford dispensary, where someone, and this is the magic box part, I don't really understand this, will authorize, will say, yes, this is on the list of debilitating diseases, and so we can give it to you. So if that list weren't there, and I'm not sure that's the right system, but that's what I think happens now. So if we take away that list, then what's going to happen with the prescribing physician's note that gets taken to Bedford or wherever, the dispensary, and they say, who's going to say now, because the physician is not going to say, this is a disorder that I'm going to treat with medical marijuana, because there is no efficacy data out yet. So,
Yeah.
and it's not a prescription anyone can write, because it's a DEA prescription and it's illegal.
Right,
So
it's a
I wondered
recommendation.
if someone could
Right.
go through that.
Is there
process.
someone who could, sure. Welcome aboard.
Thank you. Senator Brakey, Representative Kateen, and members of the committee, thank you very much for your time. And Representative Hymanson, I appreciate your question. To answer what happens in the magic box, I'm sorry, I'm Becky DeCoyster with the Wellness Connection of Maine, Director of Community and Education. Thank you. When the patient with the certification card comes to the dispensary, we sit down and do an intake interview with them, and we spend a significant amount of time talking with them about, as far as they're comfortable sharing with us, their condition or the symptoms that they are trying to treat. And so in that interview and subsequent interviews and discussions, we help them dial in a delivery method, a strain that might work best for them. We certainly, we're serving about 8,000 patients around the state that have one of the qualifying conditions that are currently listed. What we hear a lot from these folks is, not only do I have better appetite now, even though I'm going through chemo,
No, I understand that part.
but I can also sleep.
Right, no, I understand that part, but
Okay.
what I'm saying is from the physician's, toolbox of, this is what I'm writing on a piece of paper, those qualifying conditions, is that different from the disabling language that we're talking about now?
Debilitating.
Debilitating, whatever that is.
I believe that this would,
So the qualifying conditions would stay under this?
that one maybe I'm not best positioned to answer.
Oh, yeah, so the list of debilitating medical conditions
Right.
are those: cancer, glaucoma, HIV, hepatitis C, ALS, Crohn's, agitation, nail patella syndrome, chewing, chronic disability. All right, so those are the ones. So if these went away, right, as this bill says, and there weren't qualifying debilitating medical conditions, what would the piece of paper that came to you from a physician say?
I believe that the language would stay the same, because what the physician's piece of that designation form says is simply that I certify that you have a condition that may benefit from the use of medical cannabis, and that if you, my patient, choose to try that, I will continue to monitor your health and well-being.
Because oftentimes the note that you'd receive from the physician is just, this is a patient with blank, not,
No, when the patient, you remember the form with the two cards that we got out this
Yeah.
morning? So now when a patient comes to us, they present us with one of those cards that has very limiting information. It doesn't list what the condition is currently. So we don't know when a patient comes to us what their condition is. It's not on their card.
but what I'm asking is, what does the physician write if there's no medical evidence that medical marijuana is a treatment for blank disorder, except this person has this disorder?
It is not a prescription. And so to say that mindset, I think, is limiting. So what the physician is doing when they provide one of these certification cards is saying, I believe that this patient will benefit or may benefit from using medical cannabis. The form itself doesn't require the doctor to say which qualifying condition currently, and
I think the resident Sanderson has something she'd like to add to this, if she can.
I'm confused.
I think maybe it's a clarifying question for Representative Hymanson, because I'm a little, from what I'm hearing you asking is, I'm gonna write down that someone has Parkinson's and then they're gonna go to the dispensary, okay? What happens is, and you can correct me if this is not doesn't answer your question, is when you go to a physician, the physician will make the determination of what your condition is, and depending on how you feel would best serve their needs as far as a medication, be it a pharmaceutical that you get from a prescription in the pharmacy, or if you feel that perhaps recommending medical marijuana for the condition that they may have would be an appropriate thing, then if you feel they would be recommended marijuana may be helpful, that's when you would enter that portal and actually issue the actual certification piece. And then they would take that either to a dispensary or a caregiver. So that's how that works. And you don't just write on a piece of paper, they have Parkinson's,
That's what
for medical marijuana, without the certification form. And then they went to a certifying
Whoever, that's the
doctor.
black.
Representative Burstein?
I'm thinking to answer Representative Hyman's question, I think she's saying that she doesn't want to write the prescription, or she doesn't want to do the card because she then puts the flag up for the feds. So doesn't the initial doctor then say you need to go to a physician that will provide a card? Right, yeah. And then that patient has his or her card, and then they go to the dispensary. So they have to find a physician that will write that, will work and do that portal and create the cards.
But any MD, DO, or NB may do that.
Yes. Representative Gattin?
But no MD, DO, NP has to do it.
Correct.
So
Are there further questions? Representative Burstein?
Thank you. So what I'm reading in here is basically, if I say, you know, I'm just really having an issue with muscle tightness, or, you know, something like that that's not on that list, I now can go to someone who will provide me a card and say, I think I could really benefit from this. And so I'm comfortable with it. That's my understanding.
There's been an ask for a corner caucus, so we're gonna take a quick break to do a corner caucus.